पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते ओम शांति 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 हरि ओम हरि ओम.
So I don't know where Vasan has come, but anyway, so today as a continuation of Vedic prayer, we just recite a few lines from Surya Atharvani Upanishad, where for today's topic, Surya Bhagavan is the promulgator, source and resource. So just few lines from that, and then we go to next program. Sri Gurubhyo Namaha Athas Om Atha Surya Tharvangira Samvyakhyasyamaha Brahma Rishi Gayatri Chandaha Adityo Devata Hamsaha Sohamagni Narayana Yuktam Bijam Hrillekha Shakti Vyadadi Sargasam Yuktam Kilakam Chaturvidha Purushartha Siddhyarthe Viniyogaha Shatswararudhena Bijena Shadangam Raktambuja Samsthitam Saptaswarathinam Hiranyavarnam Chaturbhujam Padadvaya Padmadvaya Abhayavarada Hastam Kalachakra Pranetaram Sri Suryanarayanam Ya Evam Veda Savai Brahmanaha Om Bhur Bhuvasvaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayatu Surya Atma Jagataha Astushascha Suryadvai Khalvimani Bhuta Nijayamte Suryad Jagna Parjanyonamatma Namaste Aditya Om Surye Layam Prapnuvanti Yas Surya Sohamevacha Chachurno Devasavita Chachurna Uta Parvataha Chachurdhata Dadhatuna Adityaya Vidmahe Sahasrakiranaya Dhimahi Tanna Suryaha Prachodayatu Om Shanti 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 Om Sri Suryanarayana Swamine Namaha Om Namo Narayanaya Om Shanti Shanti Shanti. Yes, Prasad.
Yes. So I want to welcome everybody to today's talk by Dr. Harathi Bandaru. So we have a very distinct privilege to get a very distinguished doctor to talk to us. The talk today is on awareness of brain stroke and other neurological diseases. So we will start with Sangeetanjali, then I will play a small video, and then we'll have the introduction to the keynote speaker, and then we'll have the keynote talk. So, so Mahesh is ready. So please, Mahesh, go ahead.
Namaste, my name is Mahesh and I'll be singing Mahaganapati. Vakratunda Mahakaya Koti Surya Samaprabha Nirvignam Kurume Deva Sarvakaryeshu Sarvada Mahaganapatim Manasa Smarami Mahaganapatim Manasa Smarami Mahaganapatim Manasa Smarami Mahaganapatim Manasa स्मरामि महागणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दितमहागणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दितमहागणपतिम् Mahadevasuto Guru Guhanuto Mahadevasuto Guru Guhanuto Marakoti Prakasham Shantam Mahadevasuto Guru Guhanuto Marakoti Prakasham Shantam Mahakavya Natakadipriyam Mahakavya Natakadipriyam Mushikavahana Modaka Priyam Mahakavya Natakadipriyam Mushikavahana Modaka Priyam Mahaganapatyam Manasa Smarami Vasishtavamadevaदिवन्दितमहागणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दितमहागणपतिम्
Thank you very much.
Namaste.
Thank you, Mahesh. Very nice. So I want to introduce the speaker a little bit. So Dr. Harathi Bandaru is from Columbia, Missouri. So she's a very dear friend, but a very accomplished doctor. She's a fellow of American College of Physicians. She's a fellow of American College of Gastroenterology, and her main job now is as a neurologist. And she has many awards. So it's good to be a great doctor, but it's even more wonderful to see her work being recognized. So here are some of her awards. She has an Outstanding Achievement Award, and the awards are like in plenty. So I'm just going to scroll through a few of those here. She has received, and she's a very active contributor to the community, both in medical side as well as even the cultural side. And we're so happy that she's here to share with us her experiences and her advice for all of us on this very important topic. And then I want to introduce some more before she starts.
Yes. Hello, welcome to everybody. And Harathi Bandaru, she's now talking on the stroke and other neurological diseases, or otherwise it's called brain stroke and all that. Very interesting. And at the moment, when I was there in Colombia, and I was introduced to this great lady doctor, and a friend and affectionate daughter. Like she has given me a promise. Uncle, anytime you call, I will receive your phone call. She has been like that. So though very busy, but still trying to be human and normal, attentive to that. That is what is the godly nature. Paramatma is busy, but still whenever you call, he will be attending. So I must be very much thankful to this doctor who has agreed to speak in our monthly meet program, and trying to, because our monthly meet, our Nada Veda Adhyayana Kendra is completely all-round multidisciplinary society, or multidisciplinary. Therefore, we have got medicine, astrology, astronomy, Veda, Purana, everything comes into the net. Therefore, this time we have been having good doctors like Dr. Anand and Smita and then Chokalingam and so on. So they're also part of the Vedic wisdom and Vedic knowledge. So I just want to tell you that brain is an important thing. And so that's what we call Siraha. And in our Veda and in Upanishads and also in Bhagavad Gita, you come across a beautiful Urdhva Moolam Athashakham Vrutsham Yo Veda Samprati. See, man is but inverted tree. For a tree, the roots are down the earth inside. But for man, all the roots of entire activities, signals, and all other indications and all that comes only from the brain. And also the nerves are important, which keep the entire system inside the body quite strong and straight. And all the creation, activity, growth, development, and everything happens because of the brain health. Therefore, if brain is healthy, there is a balance and there is all that. And this kind of caution has been given to us in our Vedas. So, say, Murdha Moolam Adhyayana. All our hands, legs, and all other parts downwards is there. The head is there. And also in Sandhya Vandanam, Gayatri Upasana, we always, every time we say, Brahma, Siraha. See, what is Siraha? What is the head or what is the brain? Brahma Deva is sitting there. Brahma is the creator. So, Brahma, Siraha. And then we get the description. Again, the forehead also is important. Lalatam, Lalate Rudra Hatishtantu. So, let Rudra stay in the Lalatam. And Rudra, they are remover of our dukkham. Remover or make us very much active and energetic. Number of definitions are there. So, Rudraha Lalate Tishtantu. And other than that, we have one Homa in Mahanarayana Upanishad, Mantraha, which is called as Viraja Homa. And because today doctor is talking about the neurological health also, apart from the disease, ease also is important. So that ease means Shuddhi. And so in Aruna Prasna, Taittiriya Aranyakam and Aruna Prasna, that is Aruna Prasna, and also in Mahanarayana Upanishad, a lot of information is there. That's what I was always telling Harathi whenever I meet. Veda is the origin, and now whatever study is different. So one more point I tell you, that Twakcharmamagum Sarudhira Majja Medhava Snayavosthini me Sudhyantam Jyotiraham Viraja Vipapma Bhuya Sadgum Swaha. So there, our body consists of 8 layers, beginning from outer skin, inner skin, then flesh, then etc. And the penultimate layer of our body, doctor knows better, but I know little only. So the penultimate part of our body is the nerves, snayavaha, that is in Sanskrit you say. And then you get to the asthini, the bones. And moreover, that's why is snayavaha, the nerves are visible. Nerves are important. So there should be Shuddhi for the nerves. So the doctor, neurologist today we have, she will also talk about the care or Shuddhi for our nerves, our nervous strength, nervous health. And so Snayavaha Sudhyantam. If that Shuddhi is hurt, then the problems crop up. So that we call it as a diseases. So I can give number of references from our Vedas, and our Rishis have got a perfect knowledge about our system, more so the brain. And all we know that the body, the nerves and all the sensitivity is able to stand the pain to some extent. Supposing the pain is too much in the body because of number of other reasons, the brain becomes silent. That is called as a coma and all that. That is, nerves also stop in communicating and all that. So I don't want to talk much about the Vedic aspect of this particular subject today we have taken, but I just want to make people aware that the knowledge is originated from our Rishis, and we know more about the practical contemporary knowledge, which all very much great neurological doctors are able to do research and find out new things. So there is no end for the neurological research, development, and then cure and all those things. So not taking much time I just introduced Harathi Bandaru, who have readily agreed to us, but it's a long pending program. We had to go away to India, come back, and then renew our request. Amma, long back, I requested you, and she readily agreed, and she's sparing some time, So welcome to Dr. Harathi. We're so happy to listen to you and to see you and get knowledge from your practical, everyday, clinical, etc. research experiences. Welcome. Thank you very much.
Thank you so much, Uncle. Thank you so much, Prasad Garu. It's my privilege to be here. So when we were talking to do this program, we were like thinking just to do something very common, which a common man can understand, which they can put it in their regular lifestyle changes so that they can make all these modifications to bring a good lifestyle and to prevent neurological diseases. So the main goal of this presentation is to give an idea of the most important neurological disorders and what are the risk factors and what do you need to do, to prevent them. That's the main goal of this presentation. And thanks again for inviting me here. I'll share my screen. Topic is awareness of brain stroke and other neurological disorders. Basically, I'm going to talk about a little bit about Parkinson's disease too and dementia. These are the most three common neurological diseases, and we'll start. I would like to acknowledge my wonderful nursing team, Ms. Jennifer Warren and Ms. Lauren Geyer, and my stroke coordinator team, Ms. Joyce, and my physical therapy and occupational therapy team, Ms. Brianna Cowley. And there is also palliative care services to help to extend extra help to the families, Ms. Kimberly. As I said before, we are going to talk about stroke awareness, and we are going to talk about Parkinson's disease, and we are going to talk about dementia, the three most important neurological disorders. When it comes to brain, time is brain. It's time lost is equal to brain lost. How soon you respond to the problem, then the best way you're treating your brain. Especially when it comes to stroke, it's like very, very crucial to reach the hospital on time. Time is really, really important. Some treatments can be given only if you reach the hospital on time. They're not eligible to get those treatments if they don't arrive the hospital on time. That's why with respect to brain, time is brain. Time lost is equal to brain lost. When we look at the cause of death recently in early 2021, yeah, of course, COVID became the number one. We all know that. When you look at the neurological disorders, stroke and dementia, these are the most common. That's the reason why I picked, it's good to talk about stroke, dementia, and Parkinson's is very upcoming, we are diagnosing a lot of patients. So we are also going to talk about that. Stroke accounts for at least 1 in every 19 deaths. It's such a common thing, very, very common. So strokes are two types. One, when the brain vessel is blocked, that is ischemic stroke. When, because of the elevated blood pressure, when the blood vessel ruptures and blood leaks into the brain, that is called hemorrhagic stroke. 85% of the stroke are ischemic strokes. 15% of the strokes are hemorrhagic stroke. Why it is important is, it is important to know the type of the stroke because the treatment is completely different. But we mostly cover ischemic stroke because it's contributing to 85%. Most common risk factors everyone should remember, especially for stroke. Hypertension is the most common. Blood pressure control is the must. It's very, very important, very important. The other risk factors are smoking, weight, always we have to control the weight, obesity. It could be some medications, especially if you have heart disease with irregular heartbeat. It tries to throw clots into the brain, causing strokes, brain strokes. If you lack physical activity and if you have a sedentary lifestyle, it is very important to have good exercise. Stress, alcohol, as I spoke to you, high blood pressure, diabetes, and high cholesterol, and smoking. These are the most common risk factors, but the most important, especially for the stroke, is high blood pressure. As per American Heart Association, everyone should remember this magical number 120/80. 120 is the upper number. When you take the blood pressure, the upper number is the systolic blood pressure, that is 120. The lower number is the diastolic blood pressure, 80. The normal blood pressure, you have to make sure it should be less than 120/80. If any time the blood pressure is high, you make sure you talk to your primary care physicians and make sure it is under control, because that is very important to prevent all the diseases. So how do you know, what are the symptoms of the stroke? So usually everyone thinks, lack of function of the limbs, like, cannot move the arm, cannot move the leg. Okay, that can be stroke. But there are very important other features. If the patient has loss of balance, sudden onset of headaches, sudden onset of dizziness, sudden loss of vision, especially with driving, usually they come up with making small accidents. And facial weakness, face shape will be changed and there is a facial droop. And arm weakness. Arm weakness, most of us know, because most of the strokes they present with arm or leg weakness. Speech difficulty, very important. Speech difficulty is one of the key things. Again, whenever patient comes with speech difficulty, the treatment will be very aggressive because we don't want to lose the brain. So when anyone has these symptoms, time to call 911 and they need to come to the hospital. Once they come to the hospital on time, then only we can give some treatments. As I said, it's time critical. When any patient comes within 4.5 hours of the stroke, then only we can give this clot busting drug. Otherwise, we cannot give this medication. That's the reason why it's time critical and time is brain. If the clot is very big, you can also remove the clot. For clot removal, we have 24 hours time. This is the clot busting medication. It goes in and it clears. This is the clot. It clears all the clot. The highest benefits you see when you come within 3 hours, but you have time until 4.5 hours. And there's another way to remove the clot by the specialty team. This is called thrombectomy. You have 24 hours to do that. So that's the reason why time is very, very important. As you all know, when you come with stroke, most of the physicians, they treat with medications, aspirin, cholesterol medication. And again, we educate them, please make sure you control your blood pressure, please. And then we will give good physical therapy, occupational therapy, and speech therapy if they have any speech problem. But what do you do from your side? Anyway, when you come to the hospital, we will give treatment. But what do you do from your side to prevent this? Since blood pressure is the most common risk factor and very important risk factor, always make sure you control the blood pressure. As I mentioned, make sure the blood pressure is less than 120/80. Make sure you control your cholesterol levels. Always eat healthy food. Make sure you exercise regularly. And one more very important thing, sleep apnea. Nowadays, we see sleep apnea a lot. So what do you mean by sleep apnea? So during the sleep, the brain is not getting enough oxygen and they snore. That's the reason why we educate. When you snore a lot, please make sure to rule out sleep apnea. Sleep apnea increases the risk of stroke, increases the risk of migraines. It causes many neurological disorders because brain is not getting enough oxygen while sleeping. Make sure we manage the diabetes, alcohol in moderation. Smoking is one of the highest risk factor along with high blood pressure because it causes all the changes in the brain vessels causing stroke. Avoid stress, try to maintain healthy weight. So you might have heard about mini stroke. So most of the people, some people say that, okay, they had a stroke, but God's grace, they didn't have any weakness, everything improved. So that is really good. So that is called mini stroke. Mini stroke means the patient does not have any weakness, any facial droop, but it's kind of a warning. So you are likely to have a stroke in the future. So please be careful. So that's the reason why whenever they get this warning, we still do the complete stroke workup. We still put the patient on good medications, and we will tell them to maintain, all the healthy lifestyle changes, blood pressure control, diabetes control, and cholesterol control. We will do everything the same, even though it's a mini stroke, even though it does not have any deficits in the patients, but still we will educate all the patients to follow, to make all lifestyle changes. So we almost came to the conclusion of stroke, and we are going to move to the next topic, Parkinson's. So in summary, what we learned, time is brain. Realize that hypertension is the most common risk factor. Always make sure you control the blood pressure. And we talked about the the signs and clinical presentation, like, just not only the weakness of the arms, but any facial weakness, any speech problems, any dizziness. All these are very important, especially vision loss. So you need to come to the hospital on time, and you're given medications and you're given physical therapy. One more important thing, it's the very easiest thing to understand. So dehydration. So whenever any patient comes with stroke, the first thing that we do in the hospital, we give IV fluids. So that's the reason why make sure you always hydrate. That's the reason why Ayurveda, everyone talks about make sure you drink water before going to bed, make sure you hydrate yourself, make sure you drink water in the early morning, clean out your stomach, make sure you hydrate throughout the day. And in our tradition also, that's why they say always carry water with you. It's a good sign. I mean, it's auspicious. So this is one of the reasons, health-wise, scientific-wise. So carrying water, drinking on time, it prevents a lot of diseases. Stroke is one of them. So hydration is very important. And for brain, when you look at the shape of the walnut, it looks like brain. I always tell this to my patients. So almost brain looks similar to walnut. Walnut shape looks like a brain when you pay attention to it. So walnut is very, very important. It contains very good omega-3 fatty acids. It is very good for brain. It's a super brain food, it's called as. It whenever you feel fatigued, whenever you feel tired, you feel very energetic with nuts, like especially walnuts and almonds. They are the best. So it's always recommended to eat super brain foods like nuts. Kiwi. Kiwi is naturally a very important fruit. Usually you give blood thinners when you get stroke, but kiwi naturally it cleans the blood vessels. So it's an important fruit. Even though you cannot say that it's a medication, but it has a very good medicinal values to thin the blood. Flax seeds have very good omega-3 fatty acids. It prevents cholesterol and it's very important. Beetroot, I think again in Ayurveda, we talked about beetroot juice, carrot juice. And I recently read an article, someone forwarded me this one in WhatsApp. So a mix of carrot and green apple and beetroot together, a fresh juice, it helps in many diseases, especially cancer and stroke. So let's move on. So now we are going to talk about Parkinson's disease. Parkinson's disease, what is this disease? It's like, we heard about this disease, but what is it? So this is a normal brain. You need this pigment, in order to have good movements of your body. Like, when you walk, in order to have sharp movements, you need this pigment. But when you look at Parkinson's patient's brain, you don't have this pigment. So that's the reason why patient is very unsteady while they walk. They don't have sharp movements. Their gait is unsteady, shuffling gait. Let me show you the picture. This is the way the typical posture of Parkinson's. And they have significant tremors, especially resting tremors. When they sit, also when they are not doing anything, still they have this tremor. We are so lucky to have a nice tone to our muscles, but in Parkinson's, they are very stiff. They cannot move freely. It's very difficult for them to move. So it's like, why they are not moving? It's so easy to get up and walk, but still their brain is not coordinating with their muscles and they cannot move. And they don't have good expression. It's always have good bhava, good expression on your face, a smile. They lack expression. That's why they have mask-like faces, no expression on their face. So because of tightness in the whole body, their posture is very tight and they cannot walk, they fall a lot. They have a lot of imbalance, like, very unsteady gait. More than 1 million people are, diagnosed with Parkinson's disease, especially symptoms worse with time. It is a progressive disease. We give medications to help with the symptoms, but we cannot stop the disease. It's very important to know. That's why since we cannot stop the disease, the medications that we are giving, it is just to improve the symptoms. So it's important to prevent it. How are you going to prevent it? We are going to talk about it. So as a physician, obviously, we give medications. I'm not going to talk about the medications. You have to follow all the guidelines. And then if medications are not working, you're going to stimulate the brain by putting electrodes. Again, this will be done by neurosurgeon. This is just to give an idea. So every Parkinson patient is different. Some people, they have more tremor. Some people, they are more rigid. But what do you do, to prevent? Some Parkinson patients, they really have good lifestyle. They do everything. They don't miss anything. They have balance. So for that, remaining active through exercise, stimulating your brain, doing exercise on a regular basis, that is very, very important, especially for Parkinson's disease. And again, what kind of foods you need to eat? It's good for the Parkinson's disease, especially. As I told you, walnut is my favorite. I always suggest all my patients, eat walnuts, at least 6 to 8 walnuts per day. And flax seeds, they are very rich in omega-3 fatty acids. So that's why it's good for the brain. Especially people who love fish, salmon is rich in all brain superfoods. With respect to fruits, Parkinson's patients, they have very abnormal bowel movements. They are constipated. So we highly encourage them to eat fruits, vegetables, especially as I mentioned, carrot, beetroot, cabbage. These are one of the important foods. And grapes, pineapple, figs, blueberries. So the problem with Parkinson's is the patients, they don't have the pigmentation as I showed in the picture. So almonds help to some extent to produce that pigmentation. So again, I highly recommend them to eat almonds too. So when we talk about sesame seeds, so I think all my grandmothers, grandfather, they always tell you, okay, eat sesame seed, that sweet made by sesame seed. When you mix dates with sesame seeds, that's very good for you, please eat it. So that is the reason why they say like sesame seeds help in dopamine production. That's the reason why people, they have good brain dopamine production, so that later on in their life, they have less chances of getting Parkinson's disease. Especially with respect to tremors, the foods that help in tremors are broccoli, spinach, and plenty of water. The key point is water is the most important thing. Keeping yourself hydrated is the most important thing for any neurological disorders. So what else do you take care of yourself for Parkinson's disease? Anulom Vilom Pranayam. So alternate nostril breathing. Everyone knows about this. This is one of the most important pranayam for Parkinson's disease. And it's very easy. You can do it at home. And a lot of books written on this. And I educate my patients to practice on a daily basis at home. Yoga helps a lot, especially Parkinson's disease is a problem in the balance. What is yoga? Yoga, the postures, they teach you how to maintain balance. So yoga really helps in Parkinson's disease. And make sure you avoid all processed foods, artificial sweeteners, added sugars, especially in Parkinson's. Usually, after 4 or 5 years after diagnosing Parkinson's, in addition to tremors, in addition to balance problems, they also have speech problems. So they cannot express, their voice is not clear. They talk like very slowly, ha ha, like that, making hypokinetic speech. So for that, we have a special physical therapy. So without giving medications, you can do a lot of things to help with your Parkinson's, especially Anulom Vilom, yogas, avoiding bad foods, and then getting this speech therapy. So do they die because of Parkinson's? No. Usually people die because of complications related to Parkinson's. No, they don't die because of Parkinson's. Because of lack of balance, they fall. So that's the reason why it's important to educate. Make sure you don't fall. Make sure you correct at your home. Make sure you put enough light, remove the clutter, and make sure there are no wires in between. Because Parkinson's admissions, they come with falls most of the times. Let's move on to dementia. So what is dementia? So in general, you forget things like, but the real definition is there is a cognitive impairment. It's not just forgetting things. There is something missing. The cognition is missing. So again, there are many causes of dementia, but Alzheimer's dementia is the 50 to 75% of the patients are Alzheimer's dementia. So we are going to talk about what it is and how to prevent it. So this is a progressive degeneration. Basically, the cognitive abilities of a patient are degenerated progressively. It is a progressive disease. It can simply range from just forgetfulness to forget everything. They even forget their loving, their family members. They don't remember any names. Sometimes they lose their speech. They cannot move. That is in the later stages. So normal brain looks like this, but Alzheimer's brain, it shrinks. The size is shrink, atrophied. What are the risk factors of dementia? So you use the brain or you lose the brain. It's always good to use the brain. It is always good to use to make your brain active, to learn new things, to be involved socially, and to be happy. Very important. If you learn new things, your brain will try to accommodate the new learning, and you have less chances of dementia. The risk factors are not enough aerobic physical activity, again smoking, always smoking comes everywhere, excessive alcohol use, obesity, hypertension. This is a hypertension also, it's important for everything. diabetes, depression. So happy mind is always good. If you don't want to have any diseases, always keep your mind clutter-free and always happy. So if any person is depressed, they are going to produce abnormal hormones in their brain, leading to dementias. That's why always laughing therapy, keeping very happy, always be positive. These are the things which are very important in general. These are easy to say, but it's very important to keep in our lives and execute them so that we can be happy. Always keep your brain healthy and happy. So what are the signs and symptoms? Poor judgment means cognition is decreased. Just forgetting things here and there, that's okay. It's like, it happens to everyone. But the abstract thinking, cognition, like poor judgment, just forget the family members, and problems with language. They want to say something, but they cannot express properly. And they always feel depressed, lack of initiation. They misplace things and difficulty performing familiar tasks. Means they used to do these things very well before. Okay, they were like CEOs, they used to execute, they used to multitask before, but now they were unable to do those things. So execution problem. All of a sudden change in personality. Usually baseline, they are very happy people, but they feel sad, they feel that they're depressed, and they don't know the time, they don't know which year it is. So whenever a dementia patient comes, they say like, what is the year? That's one of the important questions. So what is the day today? Is it Monday, Tuesday? So they cannot say. And then when I ask them, oh, I'm retired, that's why I don't have to look at the calendar. But I encourage them, no, I understand, but still it's important. Please look at the calendar and make sure you are aware what day, what month. It's important to be aware of your time. So then they made it as a part of their schedule to check their time in their calendars, and changes in their mood or behavior. So again, we treat with medications, but we tell family members especially to stimulate their brain, like, puzzle games, memory games, and especially there are a lot of games on the phone that stimulate your brain. You need to think in order to solve those puzzles. And we also tell them, okay, music therapy, dance. When you do a dance, you have to coordinate your brain with your dance steps. So which means you're like exercising your brain in order to do those steps. So it's very important. And then lifestyle changes. As I said, either you use your brain, otherwise you're going to lose your brain. Recent, I think last 2 weeks ago, CNN came up with like, as long as you walk at least 9,826 steps per day, especially age groups between 40 and 79, they were like 50% less likely to develop dementia within 7 years. But if you run, if you jog, if you go on a greater speed, 6,315 steps a day is good enough. Overall, what they are saying, so always make sure you're very active, make sure you do enough exercise, make sure you involve socially, always keep your mind healthy and happy, be active and learn new things, be a lifelong student. Again, what foods are good to prevent dementia? My article came in the news, Elusive Solution for Dementia. The title is very good, but there is no clear solution for dementia. Medications, they help to stabilize, but they do not solve the problem. They do not correct the memory issues. They do not correct the dementia. Dementia is a progressive disease. What we can do is, by changing our lifestyle, we can slow the progression of the disease. That's the only thing that we can do, but we cannot stop it. So the foods, again, very good in dementia. Almonds and walnuts. Walnuts are my favorite, like, not to eat, but my favorite to tell to my patients that, it's at least 6 to 8 per day. And green leafy vegetables, spinach, broccoli, and all berries. Berries are very good, especially the foods which are very rich in antioxidants. They are very good for the brain. And again, in Ayurveda, the best oil for dementia is coconut oil. As again, here also it's mentioned, it's proven coconut oil is very good for the brain, and it's good for dementia too. So again, flax seeds, which are very rich in omega-3 fatty acids. So they are very good especially for dementia. We might have heard about ashwagandha. Now, ashwagandha is available everywhere in the United States, in Costco, Sam's, I think everywhere you can get ashwagandha. Ashwagandha, most of my patients, in addition to taking regular tablets, they have been using this ashwagandha. Ashwagandha helps them whenever they have neurological problems. They have a lot of anxiety. They have a lot of mood issue. They can't sleep well, insomnia, not sleeping enough. So ashwagandha it's helping them to reduce anxiety, to balance their mood, to sleep well. So I highly recommend ashwagandha because I saw a lot of good changes in my patients. I think you might have heard about turmeric, curcumin. So we've been using turmeric in our culture since many, many years. So turmeric has an anti-inflammatory product called curcumin. Curcumin is basically, it is good for everything. It's anti-inflammatory, any joint problems, any brain inflammation, any inflammation in the body. Since it's anti-inflammatory, that's very good. So overall, from our side, we have make sure you do good exercise, eat regularly almonds and walnuts, which are super brain foods. Berries, coconut oil is good for dementia. Flax seeds naturally reduce the cholesterol levels in a natural way. Instead of taking a lot of pills for insomnia, anxiety, try ashwagandha. Naturally, it's good. And turmeric, we always put it on a regular basis in our dishes. So it's very good. So it is never too late to start making healthier choice. You can start at any time. Don't feel bad like, oh, I didn't do it. You can start it from now. Always try to get enough sleep. Make sure you get regular checkups through the primary care physician. Why? Because if blood pressure is high, sometimes you may not know because you don't check it. So make sure you check. Make sure if it is not controlled, talk to your primary care and get it under control. Always aim for very good exercise. Exercise helps for stroke, Parkinson's, dementia, everything. If you don't have enough time, at least try to walk at least 6,000 steps a day. And yoga, breathing exercises, it helps in postures. It helps stimulating your brain and nerves. And nuts, fruits, and green leafy vegetables are super brain foods. Always eat healthy diet. Avoid preservatives and added sugars, chips, concentrated fats. reduce your intake of salt, intake of sodium, and do not smoke. If you are smoking, please quit it. Bottom line point is your brain is in your hands. So follow all these things and make your brain happy and healthy all the time. And always your brain will be happy too and healthy too. Thank you so much for patiently hearing my presentation. It's an opportunity. Thank you.
Thank you very much, Harathi. A very wonderful talk, very useful advice. We can take some questions. At least I have one question. So,
Sure.
Hydration, you said, is very important. I've also had, this awareness of vertigo, like they say again, hydration for vertigo. So, what is this vertigo idea, and what is hydration doing for it?
So vertigo means you feel like everything is moving around you. So vertigo, that's why I kept in one of my slides. I mentioned this in one of my slides. Dizziness, vertigo can be, it is related to real brain problem or it is related to inner ear problem. So whenever you have vertigo, you have to make sure you don't have brain stroke. That's the number one thing we have to do first. Then once we realize that they don't have any stroke and they just have vertigo, then we tell them, okay, to do vestibular exercises. Vestibular exercises is a medical term to be called, but really these are balance exercise. Physical therapists make you to do. And when you drink lots of water, you're giving a lot of hydration to your brain, all the organs like, ear, there are like semicircular canals inside the ear. So you're hydrating everything. So when you hydrate, obviously, you're trying to balance all the system. That's why they say, okay, hydrate. But hydration is a common suggestion for most of the diseases. It won't particularly do something for vertigo. Overall, it's hydrating all the organs, since when you have vertigo, your brain and inner ear are affected. Since you are hydrating them, it's useful. But again, it won't particularly solve it.
Yeah, I have one question. Excuse me, doctor.
Please.
I am Gopal from Bengaluru.
Hi.
Yeah, hi. Namaste. I'm very glad to introduce myself. I've been teaching yoga in this institution from the past more than 2 decades.
Wonderful.
Dr. Prabhakar know about me. And this is my background. I'm very happy you mentioned about prevention is better than cure. And you mentioned some of the points relating to yoga, particularly this breathing techniques and all. I've been teaching about 10 to 15 types of breathing exercises.
Yes.
So I'm very happy you mentioned it. Earlier, why I'm telling you, I'm again and again thanking you, earlier, when I started practicing yoga in 1975, many of the allopathic doctors, they were allergic to yoga. They were never bothered about yoga. They said, we do not anything. If you want to do it. But now, almost all the doctors, they speak about yoga. They recommend it. And I am very happy about it. Thank you very much. I am very grateful to you.
That's true. That's why we are talking about it. Because it is really working. That's why we are talking about it. Thank you.
And one point what you raised is normally, including me, though I am practicing, sometimes our breathing is defective because we don't consume the oxygen properly. And even in a normal person also, intake of oxygen and breathing is very less because the shallow breathing is there. That's why I mentioned in my lectures also several times to have deep breathing, and it reduces tension also. So in respect, it is very beneficial. And that's the point I want to tell you. And one more thing, in this spondylitis, can you give some information, because spondylitis, whether it has any connection with the brain activities or particular therapy, or what action to be taken, prevention method? I'm very thankful to you.
No problem. So spondylitis means, especially in the neck region, right? You're talking about cervical spondylitis. Yeah.
Yeah.
Whenever there is spondylitis, the nerves coming out from the vertebra, they will be little compressed, and you may get some numbness, or you may get some jerking, sharp shooting pains. So medically, the treatment is a medication. There is one medication which stabilizes the nerve membrane so that you don't get the pain. But preventative measures, your posture should be always good. Most of the time we are busy at work, and we bend like this, and we are in abnormal postures. Whenever we are in good postures, always set your postures. That helps in the prevention of spondylitis. And there are a lot of exercises in yoga, doing on the opposite sides, especially moving the neck and doing, neck exercises. They really help on a regular basis to prevent the spondylitis. But again, can they do 100% prevention? No, because you're using your vertebral column since last many years. So can the shirt that you buy today, can it look new after 60, 65 years? No, even though you take care of that shirt very well, but you used it maybe 10 times or 20 times, you see some wear and tear because you used it, even though you took care of it very well. So people who takes care of their health well, they have less chances of getting cervical spondylitis. But if you don't take care, then you get it like sooner. But people who takes care of it also, sometimes they have chances of getting cervical spondylitis. It's because of wear and tear. Then stabilize your nerve membrane. Again, it's very easy. We can prescribe that medication. You can get in anywhere in India. And then doing neck exercises. These are the two keys which are very important for the cervical spondylitis.
Yeah. Thank you very much. You're very informative and very clear. The speech was very clear. Very, very informative and helpful.
Oh, thank you.
Thanks, sir.
Dr. Harathi, I had a question.
Sure, please.
So obviously you talked about the neurodegenerative diseases, all different kinds. There is a term which is being explored quite a bit nowadays, especially with the meditation and so on and so forth. And the term that gets used is neuroplasticity.
Yes, okay. Neuroplasticity.
Touch a little bit on that, expand. I want to understand where the current research is, how true is that, and what activities does promote neuroplasticity?
Okay, neuroplasticity is, see, let's say ex-patient got a big stroke and he has left-sided weakness, left arm and left leg weakness. But when we ask the patient, or when we put him to rehab, getting 3 to 4 hours of physical therapy, it improves. It improves after 6 months. It takes time, but it improves. So actually, when you look at the MRI, there is a dead tissue in that area. That tissue is dead. When you have a stroke, it's dead. But still, at the time of presentation, the patient cannot move anything. But why the patient is moving right now? So when he's making those muscles, when he's stimulating it, when it's like you are putting water to a plant as it grows, in the same way you're stimulating the nerves, the neurons, they try to regenerate, even though there is a dead tissue there. They try to regenerate, and then they try to give that function again to the patient, because they are stimulating. As you do, you're stimulating your neurons, you're regenerating your neurons, and then you're going to get that function back. Neuroplasticity, what activities bring this neuroplasticity? Okay, especially dance, learning new steps, especially, for example, Bharatanatyam. Bharatanatyam, you have to do in coordination. You have to do one thing in the leg, and at the same time, you have to move your, not only Bharatanatyam, like, any dance, like, which need coordination, or if you work in a group, you have to follow with the team. You cannot miss the steps. You have to go in alignment. So when you learn these things, hippocampal region, there is a temporal lobe, there is a lobe called temporal lobe, that it stimulates the new learning, new memory. When it is trying to learn these things out of neuroplasticity, basically new neurons, and then you're trying to stimulate your brain. It's like you're giving a good massage to your brain. You're giving a good rejuvenating spa treatment to your brain. So the dance, yoga, breathing, especially alternate, like, which you need to remember, okay, one time I have to do like this, one time I have to use this nostril. So you have to, the things that you need to use your brain in order to do those activities. Martial arts, the way you movement, the way you move the limb in order to strike, give the strike. So martial arts, dance, breathing treatments, alternate, especially those things are good. And it's something new, like, new, let's say you're trying to learn new courses. Even though whatever age you are at, you still need to learn along. You need to compete with the younger generations. So no matter whatever it is, so then you try to overact or stimulate your brain a lot, so it gives neuroplasticity. And whenever you observe people who dance, people who are very active, people who do all these arts, exercise, they look much younger when compared to their colleagues or their peers, because they are like doing mind exercise without realizing, actually.
Good. Thank you. That was very helpful. Just one comment. You mentioned coconut oil for dementia as a means for cooking. Coconut oil, obviously, coconut in general is high on the cholesterol side.
Right.
So even though that may help the neurodegenerative diseases, and again, everything in moderation is always good. So its impact on the cardio side, on the usually they prohibit that. Usually they restrain you from. Is there a common kind of grounds between the two, which is equally, if not equally, marginally effective both on the brain and the heart side?
Right, that's a very good question. So yeah, coconut has high cholesterol, but it also has an important product called lutein. That lutein is very important to clear the coronary vessels.
Yeah.
So first of all, most important thing is you have to use anything in moderation, which you already mentioned, very nice. But it also has an important benefit in cleaning your coronary vessels. And it's also good for dementia. And the second most important thing is coconut oil has a high boiling point. I think your avocado and coconut oil, they are the good oils. Especially with our cooking, we use a lot of oils, and then we will make sure the food is cooked well, which means you are cooking the oil at a higher temperature.
Right.
We are not eating raw foods. So since it can withstand those high temperatures, so it's not converting into free radicals. But when you talk about refined oils, when you use it for cooking, it automatically converts into free radical and it causes brain damage.
Correct.
So in that way, this is more beneficial because It's like, okay, you have to use in moderation. The lutein is good for heart as well. And then the boiling point is good as well. And it's not giving you free radicals when compared to the other oils. So that way it is beneficial.
Very good. Thank you. I appreciate that.
Any other questions, please?
Yeah, again, I'm Gopal Tirmalai, traveling you to one more question.
Yeah,
So,
please.
I have been teaching one meditation, particularly concentrating our mind on different points of our brain. That is called Sapta Bindu Dharana. We use it for a spiritual purpose, but it may be helpful for other neurological issue. That's what I feel. And my question is it okay if I teach to everybody? Is there any restrictions? Because many people, they may have some issues regarding brain problems. So is it proper to teach whomsoever they ask me to teach? Normally, I don't teach it to everybody. To my senior students only I teach.
Yeah, you can teach it to everyone. No problem.
Okay.
So
Yes, yes.
either you use it or lose it, the brain. Basically, you can teach the complicated brain stuff to anyone, which means you're
Yes.
challenging the brain, then which means you're helping them to think more and to activate the brain. So you can safely teach. And it's not a medication. You're not worried about the side effects. So it's a natural thing, natural way of thinking. So you can happily do that.
Yeah. Thanks a lot. Thank
No
you.
problem. No problem. It's my pleasure. Any other questions? Okay, then.
Yeah. Thanks a lot personally. It was very helpful even for me also.
Oh, thank you. Thank you so much. It's my privilege, and thank you, Uncle, for giving me this opportunity. Thanks a lot. Actually, I'm on call today, but I have to really thank Uncle because of him I did it. Otherwise, I would not have done this. Since I'm on call covering the hospital. But last night I was thinking about Uncle. Okay, I'm so thankful because he made me do it.
And Dr. Prabhakar, he is an inspiration for all. Even at this age, he is working like a university.
I know.
He's very highly inspiring.